Melatonin, I think of as a body clock regulator. So the brain produces melatonin in an environment of darkness, and that's one of the things that helps us go to sleep. So it really it regulates the sleep-wake cycle. So I don't think of it as like a sleep aid. It's not something I recommend to people. You know, if you have chronic insomnia, it's not recommended to take melatonin to try to sleep. However, it is indicated for certain conditions. So the American Academy of Sleep Medicine has outlined different indications for use of melatonin, and it's generally used for circadian rhythm disorders, things like delayed sleep phase syndrome, advanced sleep phase syndrome, shift work, jet lag. It's also indicated in children with neurological issues like ADHD, autism, other neurological issues. Um, and there is also some research supporting its use in adults over the age of 55 because of potential reduction in endogenous secretion of melatonin. What might be surprising to people, if your audience is mostly in the US, it may be surprising to US audiences that melatonin is not available over the counter in many other countries. In a lot of other countries, it is considered a hormone and it's available by prescription only. So in the UK, Australia, Japan, EU, other regions, it's a prescription, and it's required to be monitored every 6 months. And there is a form of melatonin called circadin that's available in the UK and Australia that's extended release 2 milligrams, indicated for adults over the age of 55 for sleep support. There's also some research looking into its use in menopause, in doses of about 3 milligrams for menopause, again, because of changes in melatonin secretion around that time of life. How I use it in my practice is kind of as a sleep support to help regulate the circadian rhythm, because I do see this with patients who have anxiety and depression and sleep issues, is sometimes they just have like their body clock is a little bit all over the place, like it's not that regulated. It may be drifting to the later side, or they might just have an irregular sleep schedule. So I'll use melatonin and light to provide anchors for their body clock while we work on other things. And I'm not generally recommending it long term unless the patient is on a melatonin depleting drug. So they might be on like a beta blocker or something like fluoxetine, which can inhibit the natural secretion of melatonin. So in those cases, we might be using it as a supplement. So yes, the short answer is there are ways to use melatonin strategically, but it's actually not recommended for chronic insomnia. But one of the things that I hear a lot from patients is I took melatonin and it didn't work, or it gave me horrible, vivid dreams, or I felt super groggy the next day. And what I'll tell them is that, well, one, it could be because it was a poor quality supplement, or it could have been the wrong dose or the wrong indication. So those are the three things that I like to look at: dosing, indication, and then supplement quality to determine, like if melatonin is going to work for that person.